topic is all about normal labor. What is normal labor, and then what is abnormal labor, and then criteria of normal labor, and then management of normal labor. So this topic is very important, very much important for our nursing student, for maternal health nursing. So one by one we'll try to know about this topic. So first come to the definition of labor. It is the series of events that take place in the genital organs in an effort to expel the viable products of conception, fetus, placenta and the membranes out of the womb through the vagina into the outer world is called labor. So what is labor? This definition we have to by heart. Series of events, it is a series means it is a serial wise. Okay, it is a series of events that take place in the genital organs, where it will take place in the genital organs. Okay, and in an effort to expel the viable products of conception. Expel means it will expel, that means out viable products. What are the viable products of conception? Fetus, placenta and the membranes out of the womb. From where? Out of the womb. Womb means the uterus. Here the womb, the uterus through the vagina into the outer world is called labor. From the uterus through the where? Through the vagina into the outer world. Okay, it's called labor. So simple. We have to know the definition is about labor is series of events that take place in the genital organs in an effort to expel the viable products of conception out of the womb through the vagina into the outer world is called labor. Here the viable products of conception are fetus, placenta and the membranes. Okay, next come to the normal labor. Hope all of you understand the definition of labor, and then next come to the normal labor. Here we have to know the definition and then what is normal labor. Okay, the normal labor also called as eutosia. For normal labor there is many criteria. It should be fulfilled, then only we can call this normal labor. The 5 criteria are present. The number 1 is spontaneous in onset and at term. Spontaneous, it should be spontaneous, it not should be forceful. Okay, and then onset and at term, and that onset and at term it should be in the spontaneously and then onset and at term, when the term will be mature. The normal gestation in that period only have to delivery, then only we can call it spontaneous in onset and at term. And then with vertex presentation. In vertex presentation means there are many presentation of fetus. Vertex presentation, breast presentation. Okay, and then face or brow presentation. But in normal labor, what should be the presentation? The vertex presentation. This like this way. Okay, the fetus head should be in down and then buttock should be in up, then it's called vertex presentation. Okay, vertex presentation. So next come to the natural termination. Number 3 is without undue prolongation. That means without undue prolongation. That means the duration of normal labor should be in normal. Okay, it not should be in prolonged time, it should be in normal time. There is a time for the first stage, second stage and third stage. So that time should be in minimum, not should be more. It not should be more prolongation. And then number 4 is natural termination with minimal aids. Natural termination means it should be natural and with minimal aids. We can't use the more forceps or more other aids for delivery. It should be in natural termination and minimal aids. The normal things are we can use for normal labor. And then 5 number is without having any complications affecting the health of the mother and or the baby. Without having any complications. Complications means without having any problem, okay, to the mother or the child. without having any complication affecting the health of the mother or the baby. In normal labor, there that have to normal and no harmful for mother health or for the baby. So these are the criteria for normal labor. What are they? The number one is spontaneous in onset and at turn, with vertex presentation, without undue prolongation, natural termination with minimal aids, without having any complications affecting the health of the mother and or the baby. Hope student all of you understand. And so next we will learn about the abnormal labor. What is abnormal labor? One is normal labor, another one is normal labor, and another one is abnormal labor. And abnormal labor also called as dystocia. Normal labor is also called as ectosia, and same as abnormal labor also called as dystocia. We have to know. Sometime the for 1 mark it may be come. So abnormal labor. What is abnormal labor? Any deviation from the definition of normal labor is called abnormal labor. Here we have to know the meaning of deviation. What is meant by deviation? Here what will happen? Any deviation, if there is any problem in abnormal labor, then it will call as abnormal labor. Okay, any deviation from the definition of normal labor, so it's called as abnormal labor. That means these are the criteria of normal labor. These 5 things have to fulfill for the normal labor. In case and for abnormal labor, if there is any problem occur in normal labor and these criteria are not followed, then it's called abnormal labor. Okay, so abnormal labor is opposite of normal labor. And then we have to know next. And then we can also see the causes of onset labor here: the uterine distension, fetoplacental contribution, estrogen, under estrogen increases, promotes, and the accelerates, and then stimulates, and then next is progesterone, and then prostaglandins, and then oxytocin and myometrial oxytocin receptors, and the neurological factors. These are the causes of onset of labor. Sometimes the question may arise from this physiology of normal labor. And then events in first stage of labor. This point also is very important. The events, that means in first stage of labor, what are the events occur? Like a dilatation of cervix, okay, the dilatation of the cervix, and then in dilatation of the cervix and the period to the onset of labor. In the pre-labor phase 1, there may be a certain amount of dilatation of cervix, especially in multiple and in some primary gravida, like, okay. And the most and then things are the axial factors of responsible are what are the uterine contraction and retraction, and then fetal axis pressure, bag of membrane, and then here and then events in second stage of labor, propulsive and expulsive. These are the main point, but mainly we have to know the mechanism of labor. We'll discuss in second video what is mechanism of labor. This is the also a main topic for discuss more things. In practical exam, this mechanism of labor they asked to demo with the pelvic bone and the fetus. Okay, so we have to know details about this mechanism of labor. So we will discuss in next video. And then here we will discuss about the management of normal labor, also very important. first stage of labor. This is also very important for the exam. Here we will discuss in three main topic. Okay, number 1 is principal, number 2 is preliminaries, and number 3 is actual management. So 1 is principles, preliminaries, and 3 is actual management. In principles, the non-interference with watchful expectancy so as to prepare the patient for natural birth, to monitor, and number 2 is to monitor carefully. We have to monitor, okay, the progress of labor, and the labor is progressing or not. And then preliminaries. In preliminaries, what will come? This consists of basic evaluation of the current clinical condition. Inquiry is to be made about the onset of labor pains or leakage of liquor, if any, through general and obstetrical examinations, including vaginal examination, are to be carried out, and recorded. Records of antenatal visits, investigations, reports, and any specific treatment given, if available, are to be reviewed. In preliminaries, here the same things are, we have to collect the data from mother, and then we have to assess the the investigation, the pre-record reports, antenatal visits, and then there is any labor pains or leakage, and then and then clinical condition, there is any clinical condition have or not, and then we have to review of that. And then actual management, this is the main things. In actual management, the first point will come general. In general, antiseptic dressing is and then encouragement. Antiseptic dressing means it should be in sterile methods. Okay, because if it's non-sterile, then it may infected to mother and then child also. So it should be antiseptic, and then encouragement, emotional support and assurance are given to keep up the morale. That means encouragement and emotional support. We have to support the mother and encouragement, okay, because in that time the mother will be emotionally affected, so we have to support emotionally. And then constant supervision is ensured. Constant supervision here means we have to supervision, that means supervise the mother. We have to continuously assess or monitor the mother, the delivery is progressing or not. We have to constant supervision. Okay, and position. In position, there will be generally a woman in early normal labor may not be confined to bed. While in bed, she may take the position most comfortable to her. It's depend on that mother in the first period time of labor. Okay, and then the bowel. In bowel, an enema is not recommended. Enema in neither shortness and then the duration of labor nor reduce the infection rate. That means we can't give the enema. Okay, it's not recommended. And then maternal rest and ambulation. If the membranes are intact, okay, the patient is allowed to walk about. If the mother mother membranes are intact, then we will allow to the mother place of walk. Okay, then it will help to break the membranes. Okay, and this attitude prevents the vena cava compression and then encourages distance of the head. That means encourages distance, then it will help to the head of the fetus will be downward. Okay, and it will help to progressing the labor. And then ambulation can reduce the duration of labor, same. And then need of analgesia and then improve maternal comfort. Analgesia, that means if mother is feel pain, then analgesics may be prescribed. Okay, then it will help to comfort the mother. And then diet. In diet, there is a delay emptying of the stomach in labor, low pace of gastric. That means there is a delay emptying of the stomach, okay, in labor, and low pace of gastric content is real danger, okay, and is aspirated flowing general anesthesia when needed unexpectedly. So food is withheld during active labor. So what we have to do, what should we do? The food is withheld during active labor. During active labor we have to food withheld, okay. And then bladder care, we need to take care of the bladder. The patient is encouraged to pass the urine by herself, as full bladder often inhibits uterine contraction, okay. Patient is encouraged to pass the urine. We should encourage the patient, please pass the urine, because if the bladder will be full, then contraction and may lead to infection, okay. The contraction may lead to infection. And then relief of pain. The relief of pain, the detail of analgesia in labor discussed in, okay, let them go. And then the common analgesia drug used in pethidine 50 to 100 mg. It's same, only for mother comfort, because if mother will suffering from pain, then it will discomfort to the mother. And so sometime what the physician will prescribe the medicine or analgesics to reduce the pain, okay. And then assessment of progress of labor and partograph recording. Here we have to assess and progress of labor by recording of recording in partograph, okay. Then it will help to the labor progressing, okay, like what we will assess in with the help of partograph. The pulse, here the pulse, blood pressure. The pulse is recorded every 30 minutes, okay. In every 30 minutes we have to record it, and blood pressure is recorded at 1 hour, okay, and temperature is recorded every 2 hours, and urine output is recorded for volume, protein or acetone, any drug, and then when given is recorded in the partograph. If any additional drug is given to the mother, then we have to record it in the partograph. For example, if any IV fluid or any analgesics is given to mother, then we have to mention that in partograph. And abdominal palpation and abdominal palpation. In abdominal palpation, we have to assess the uterine contraction as regard the frequency, intensity, and then duration are assessed. The number of contraction in 10 minutes and duration, okay, of each contraction in seconds are recorded in the partograph. So these are the things we have to record it, okay. And then here in abdominal palpation, the mainly the grip, okay, we have to assess the grip in in pelvic grip as a gradual disappearances of the pulse of the head, inciput and occiput, which were filled previously, okay. Abdominal palpation for descent of the fetal head in terms of feet tips felt above the brim is to be used, okay. Shifting the maximal intensity of the fetal heartbeat downward and medially, okay. So to note the fetal well-beings, here we have to note the fetal well-beings, the fetal are in good well-being or not. In fetal well-being, what we have to note, fetal heart rate. We have to record the fetal heart rate. In fetal heart rate, along with its rhythm and intensity, should be noted every half hour in the first stage and every 15 minutes in second stage, okay. Half hour, okay, every half hour in first stage, and then every 15 minutes in second stage for flowing rupture of membranes, okay. So and then continuous electronic fetal monitoring, and then vaginal examination. In vaginal examination, dilatation of the cervix in centimeters in relation to hours of labor is recorded, and position of the head and degree of flexion. So these are the common term. I hope you are know dilatation of the cervix. Dilatation means the cervix are dilate or not, and then what, the head of the fetus are flexion or not. That means if this one and this one, okay, extended and flex extended, okay. So we have to assess the head are flex or extended, okay. Extension, flexion. Extension, flexion. So these are, we have to know. It's the very common things. And then evidences of the fetal distress towards the maternal condition, okay. Here the then second stage of labor. Here we have to same things, principles and then general measurements, and then preparation of delivery. Principles into assess the natural expulsion of the fetus slowly, steadily, and to prevent the perennial injuries. And then general measures, the patient should be in bed, okay, and then constant supervision is mandatory. And the fetal heart rate, okay, fetal heart rate is recorded at every 5 minutes to administer inhalation analgesics, okay, if available in the gas, oxygen, nitrogen relief pain during the contraction, vaginal examination, okay. And then preparation for delivery. In preparation for delivery, position, first we have to provide the position of the woman during delivery may be lateral, okay, lateral, or the squatting or parietal sitting, which is in 45 degree, and then dorsal position with the 15 degree left lateral tilt, okay. Is commonly favored as it avoids the aortocaval compression, and then facilitates pushing effort, upright position, increase blood loss, and these are the things, okay. And then conduction of delivery, first the principles, and then second is general measures, and then preparation for delivery, and then next is conduction of labor. In conduction of labor, the assistance required in spontaneous delivery is divided into 3 phases. What are the 3 phases? Number 1 is delivery of the head. First we have to delivery of the head, and then second is delivery of the shoulders, okay, and then third is delivery of the trunk, okay. In delivery of the head, the principles to be followed are to maintain the flexion of the head, okay, flexion of the head, and to prevent its early extension, and to regulate its slow escape out of the vulval outlet. And then patient is encouraged for the bearing down efforts during the uterine contraction. This facilitates descent of the head, okay. And you can see from here, and the crowning of the head, the purpose of the increasing of the flexion of the head to ensure in this conduction of delivery, the mechanism of normal labor, it's same, okay. That means delivery of the head and delivery of the shoulders and delivery of the trunk, it's under as the mechanism of labor, same. So later one by one it will become systematically. And then care flowing delivery of the head, and then delivery of the shoulders, not to be stay in delivery of the soldier, wait for the uterine contraction. We have to wait for the uterine contraction, we can't force, okay. Then it may complicate, it may complication for the baby or mother, and come for the movements of restitution. And then external, what is restitution, what is crowning, we'll discuss in mechanism of labor, okay. And then delivery of the trunk. In delivery of the trunk, after the delivery of the soldiers, the forefinger of each hand are inserted under the axilla, and the trunk is delivered gently, lateral flexion, okay. Here, head is borne by extension, okay. This one is extensions, that means if it should be like this, okay, it should be like this. This one is flexion, extension, okay. And head drops down with the face closed, tenas, and then restitution, number 6. This one is restitution, okay. And then external rotation, it will be in the external rotation. assisted delivery of the soldiers. How the soldier will deliver by upward movement. If downward movement, by downward movement the upper soldier will deliver by downward movement, and by upward movement of head deliver with the lower soldier. Okay, that means anterior and posterior soldier. Like the assisted anterior soldier, number A is anterior soldier. Okay, this one is anterior, that means anterior means upper one, and then posterior, that means lower one. Okay, if it will down in this way, then the anterior soldier will be come, and then if the head will be in upward movement, then the posterior soldier will come, that means lower one. Okay, and then immediate care of newborn after delivery of the trunk, that means after delivery of the baby, then immediately we have to care of the newborn. There is also another topic. Okay, but soon after the delivery of the baby, it should be placed on a tray. Okay, covered with clean dry linen with the head slightly downward. Okay, in 15 degree. It facilitates drainage of the mucus. It will help to what? For what? It will help for drainage of mucus accumulated in the tracheobronchial tree by gravity, and the tray is placed between the legs of the mother and soldier be at a lower level than the uterus. Okay, and then air passes here. Soon after the delivery of the baby, what should we do? And then air passes may be cleared. Okay, mucus, and then bulb syringe suction. We have to do the suction. It will help to remove the mucus. Okay, and then Apgar scoring at 1 minute and 5 minutes is to be recorded. It's very important. We have to know the Apgar scoring. We have to do 2 times. Okay, first one is for 1 minute and then 5 minutes. Okay, at 5 minutes, 1 minute, and another one is for in 5 minutes is to be recorded when we have to record that one. And then clamping and liquid of the cord. And we have to clamping what? We have to clamping the umbilical cord. The cord is clamped by 2 Cossar's forceps. Here you can know if someone will ask you the umbilical cord by clamping by which forceps in the Cossar's. Okay, the near one is placed in 6 to 10 centimeter. It should be 6 to 10 centimeter away from the umbilicus. Okay, from the umbilicus, from the umbilicus 6 to 10 centimeter we have to clamp with the help of Cossar's forceps. Okay, management of third stage of labor. This is also very important. Third stage. Okay, first stage and third stage is more important than second stage. In third stage there will be 2 type of management, 2 methods for management. Okay, one is active management and then second one is expectant management. In active management it's preferable, and in active management underline is to powerful uterine contraction within 1 minute. And then delivery of the baby by who? By giving the presentation oxytocin. Okay, facilitate only early separation of the placenta, but also produces effective uterine contraction following this separation. There are many advantages. Okay, these are to minimize blood loss in third stage approximately to 1/5, and to shorten the duration of third stage of up, and then reduces maternal anemia, and then less need for blood transfusion. Okay, there's less need. Okay, blood transfusion, and then less need to manage the PPS. Here the PPS means postpartum hemorrhage. For the active management, if we do the active management, then it's less need for the blood transfusion and to manage the postpartum hemorrhage. It's very complicated. Okay, if a mother suffer from postpartum hemorrhage, here mainly we have to know this chart. Okay, if we know this chart, then it's easy to write in exam in expected management and then active management. First we will discuss about the active management. Okay, in active management, here this chart is very important. Okay, don't be skip this chart. We have to know in active management. First, what will you do? Injection oxytocin 10 units IM, okay, or tablet misoprostol 600 UG orally, and then or rectally, or injection metharzine 0.2 mg IM to the mother within 1 minute of birth of the baby. Okay, in active management, what we will do? Injection oxytocin 10 units IM and or oxytocin 10 units IM or tablet misoprostol 600 UG orally. Okay, and then or injection metharzine 0.2 mg IM to the mother within 1 minute of the birth of the baby. Okay, within how many minute? 1 minute. Within 1 minute birth of the baby, we have to give to the mother injection oxytocin 10 units IM or misoprostol 600 mg orally or rectally, and injection metharzine. 3 option we have to give in 3 word: injection oxytocin or tablet misoprostol or injection metharzine. Okay, and then what will happen? Delay cord clamping. We have to do delay till 90 or 120 seconds. Okay, 90 to 120 seconds we have to delay to do, and then a birth or cessation of the cord pulsation. Okay, and then clamp after 90 to 20 seconds we can clamp and divide the ligate the cord, and then to deliver the placenta after clamping the umbilical cord. Then we have to we should do to deliver the placenta by controlled contraction, CCT. Okay, enabling fast uterine contraction. When the uterine contraction will be occur, only that time we have to pull the placenta. And then next, what will you do? Massaging the uterus immediately after delivery of the placenta to insert the uterine contraction. Okay, massaging the uterus in the upper portion of the uterus we have to massage. Okay, we have to massage of the uterus, and then careful examination of the placenta for its completeness. Okay, carefully examination we have to do examine of the placenta, and then the mother the vulva area, that means vaginal examination, and then examination of the genital tract to exclude any injury and to repair if any. If during labor if there is any injury, then we have to dressing that and we have to repair that. Okay, and the genital tract we have to examine, it's important. And postpartum vigilance. In postpartum vigilance, palpation of the uterus at every 15 minutes for 2 hours to ensure uterus is hard. For identify the if is there any uterus is hard, what should we do? The palpation of the uterus, we have to palpate the uterus at every 15 minutes for 2 hours. Okay, for 2 hours, in every 15 minutes we have to palpation the uterus for identify the uterus, is there any uterus is hard or not. And then estimate the blood loss. Estimate the blood loss. There will be many during labor, the mother will lose very too much blood, so we estimate that one. And then newborn care. After that, what we should have to do? We should do newborn care. Keep the baby dry. We have to do baby dry, and then skin to skin contact with mother. We have to give in to the mother the baby for skin to skin contact to cover the baby and mother. We have to cover mother and baby both. And then we should provide the breastfeeding within an hour to the baby. Okay, and then to inspect vulva, vagina and perineum, to examine the placenta and membrane. And then expectant management. In expectant management, delivery of the baby, and then delay cord clamping 90 to 120 seconds, it's same as active management. And then clamp, divide and ligate the cord, same. And then next, wait and watch. We have to wait and to see the guard the fundus. We have to guard the fundus and wait for spontaneous separation of placenta. And wait for what? For spontaneous separation. It will be automatically, okay, spontaneously separation of placenta, and catheterize the bladder if needed. If the bladder is full of urine, then we need to do catheterize. And then placenta separated. After the placenta separated, wait for spontaneous expulsion. Okay, we have to wait for spontaneous expulsion, and with the aid of gravity or with the bearing down effect, okay, for down effect. And then fails, if it will fails, then assisted expulsion and then control contraction, okay. And then same, to examine the placenta and membrane after expulsion, and then to inspect vulva and vagina, perineum of mother. So, and the uterus is massaged, examine the placenta, membrane, cord. Okay, so like this way, okay. Expression of placenta by control contraction. What is the control contraction? See, what's the control contraction? Okay, umbilicus should pull the guard and then pull the placenta. And then expression of the placenta by fundal pressure. This is called fundus. Okay, the uterus. So expression of placenta by fundal pressure. From here, the pressure, downward movement for the placenta. So today we discuss about the labor. Summary, you can see by your one, what is happening in first stage of labor, what is happening in second stage of labor, third stage of labor. The important things are, okay. And labor, there are many things we have to know, but I just explain it in thoroughly, okay. The main things I explain. So is there any doubt, then please comment me. I will try again to understand you better. So bye bye students. In later videos we will discuss about the mechanism of normal labor, which is very important for practical exam also, okay. So any doubt, please comment me. Bye bye.